Hello, I'm Dr. David Velkoff, the Medical Director of the Drake Institute of Neurophysical Medicine. Today, I'm going to talk about the problem of autism misdiagnosis, which is more common than you might think. Parents sometimes are shocked to learn that their child that they thought was autistic actually is not autistic, is not on the spectrum. A child can have symptoms of autism-like symptoms, but not be autistic. And they can be misdiagnosed. It causes unnecessary stress and anxiety and worry for the parents. One of the most common disorders that gets misdiagnosed as autism is ADHD. ADHD children can have very poor eye contact, but it's coming from their inattention, their distractibility, not autism. They can have very impaired social skills, but it's coming from their severe impulsivity that disrupts their social interactions. The key sign that the ADHD child is not autistic, does not have autism, is they can have normal, reciprocal, back and forth conversations. They can start and sustain a conversation, unlike Autism Spectrum Disorder children. With autism, if it's a topic of specific interest of the child can sustain that conversation, but that's only in very limited situations. Normally, they're unable to start and sustain conversations and have reciprocal conversations. Another disorder that can be misdiagnosed as autism is anxiety-related disorders with social withdrawal and isolation. A child with extreme shyness and social withdrawal, it could be coming from they may be suffering with a social anxiety disorder. A social anxiety disorder will cause a child to be shut down with regards to normal social interactions. But the key point, the sign the child is not autistic, does not have autism, is the anxiety child can have normal reciprocal conversations with reciprocity. Autism children cannot. Selective mutism, another anxiety-related disorder, can also be misdiagnosed as autism. With selective mutism, the child is unable to speak in certain situations or settings, like in school, in the classroom. But the sign that they're not autistic, they don't have autism, is they could talk normally and freely at home, whereas children on the autism spectrum, they are impaired with social interactions across the board. Reactive Attachment Disorder, another disorder that can be misdiagnosed as being on the autism spectrum. Reactive Attachment Disorder is caused by early childhood trauma. The child can be withdrawn, detached, avoid eye contact and physical touch. But the sign that they're not autistic, they don't have autism, is they can have typical, age-appropriate, normal social conversations with reciprocity if they feel comfortable, like the child with social anxiety. Lastly, Obsessive-Compulsive Disorder, OCD, can be misdiagnosed as autism because the OCD child may be lining up toys, may be showing repetitive behavior. However, the sign that they're not autistic, they don't have autism, is they can have normal social interactions with reciprocity. Autism kids are unable to. With OCD, if you can redirect the child from obsessing on a topic to a different topic, and they can sustain it successfully, and they have normal social interactions, much less likely they're on the autism spectrum. Remember, again, that the child can have autism-like symptoms, but not be autistic. Whether the child is truly on the autism spectrum or not, we can still help the child. We just need to know what the accurate diagnosis is, because it will determine how many treatments a child will require and what type of neurofeedback protocols we're going to create based on their brain map findings. You must do a thorough clinical evaluation, and we then add careful clinical correlation with the quantitative EEG brain map findings. The quantitative EEG brain map is invaluable because it can show if any functional networks in the brain related to autism and social communication are dysregulated. If they are dysregulated, then it lends support that the child truly is on the autism spectrum. If the autism and social communication functional networks in the brain are normal on the QEEG brain mapping, then you really have to question the diagnosis of autism. If you found this video helpful, please like the video, and you can subscribe to our YouTube channel. There are going to be more informational videos coming soon. If you have questions about autism, please feel free to leave them in the comment section below. Thank you.